Hello and welcome to the topic Irritable Bowel Syndrome or IBS in the module Gastroenterology and Hepatology. By the end of this topic, you should be able to define Irritable Bowel Syndrome, or here on we will call it IBS, explain the pathophysiology of IBS, describe the clinical presentation of IBS, outline the investigations in the diagnosis of IBS, and finally discuss the management of IBS. Let's get started. IBS, referred to previously as spastic or nervous colon and spastic bowel, is a functional gastrointestinal disorder characterized by a group of symptoms accompanied together that include abdominal pain and changes in the consistency of bowel movements. This is different from inflammatory bowel disease or IBD, where it is a group of inflammatory conditions of the colon and small intestine, such as Crohn's disease and ulcerative colitis being the principal types. So what's the pathophysiology of IBS? It's an intestinal disorder that causes pain and flatulence as well as diarrhea and constipation. Altered gastrointestinal motility, visceral hypersensitivity, post-infectious reactivity, brain-gut interactions, alteration in fecal microflora, bacterial overgrowth, food sensitivity, carbohydrate malabsorption, and intestinal inflammation all have been implicated in the pathogenesis of IBS. It is a complex disease which arises as a result of interaction of environmental and genetic factors leading to immunological responses and inflammation within the intestines. It is actually a functional gastrointestinal disorder which is characterized by pain as well as altered bowel habits in the absence of a specific and unique organic pathology, although microscopic inflammation has been documented in some patients. So when we look at the symptoms of IBS, one may complain of abdominal cramping pain, constipation where there's infrequent stools that may be hard and dry, feeling as if one has not finished a bowel movement, having diarrhea, alternating between diarrhea and constipation, belching, flatulence, or nausea. As for signs, they may complain of having mucus in the stool, having frequent loose stools, which is diarrhea, flatulence, and belching. There's no definitive diagnosis lab tests for IBS. The purpose of lab testing is primarily to exclude any other alternative diagnosis. So typically, a full blood count will be done, and this will be done to check for presence of anemia, infection, or some other bowel diseases. So irritable bowel syndrome cannot be diagnosed by colonoscopy. But if the doctor suspects you have IBS, then he or she can proceed with a colonoscopy to ensure that there are no other organic pathologies that are involving the colon. Although they cannot confirm a diagnosis of IBS, the physicians should be able to provide a view of the gastrointestinal tract, including the abdominal organs. The results of the imaging test may indicate that the condition other than IBS may be causing the symptoms. How about management approach? So episodes of diarrhea are best managed with loperamide, while constipation often will respond to fiber supplements. Antispasmodics or anticholinergic agents may help relieve the abdominal pain of irritable bowel syndrome. Refractory cases are often treated with tricyclic antidepressants. Laxatives can help with constipation, and the only drug currently approved for IBS is a 5-HT3 antagonist that may relieve abdominal pain and slow colonic and small bowel transit. But most importantly, there are other lifestyle changes that can be adopted. And these include having a high fiber diet, increasing physical activity, managing stresses well as having a relaxation technique in your lifestyle. Can IBS be cured by surgery? Surgery has no role in treating IBS, which is a prototypic functional bowel disorder. and it is one of the several conditions known as a functional gastrointestinal disorder. This means that the bowel may function abnormally, but the tests are normal and there are no detectable structural problems. So the treatment for IBS is mainly medical in approach, and surgery is not indicated for this problem. So let's look at the summary of IBS. We understand that it is a functional gastrointestinal disorder where there is no abnormality in terms of the organic structure of it. The causes and pathophysiology are not very clear. However, there are some hypotheses that are linked to the pathogenesis as mentioned earlier. Clinical manifestations may be similar to other abdominal pathologies, such as having nausea, vomiting, but alternating constipation and diarrhea. There's no role of surgery in the treatment of IBS, namely medical approach is advocated, and here would be lifestyle changes as well as some symptomatic therapy. We have come to the end of this topic. Thank you.